The title of this video is Screening versus Assessment versus Evaluation, and the differences. Screening is a brief test or tests used to assess some skill or behavior. They provide estimates of the areas tested and may suggest a possible need of further assessments or evaluation, or may suggest there is no need for further evaluations. Screenings are not instruments to be used for diagnoses, nor alone for determining eligibility for special education and related services. Assessments, on the other hand, are more comprehensive than screening. They focus on a specific area of need and can aid in making a diagnosis. An evaluation is a comprehensive set of assessments that in total may enable a diagnosis, or may aid schools in determining eligibility for special education and related services. With all this in mind, IDEA states that screening for instructional purposes is not an evaluation. More specifically, this means that screening of a student by a teacher or a specialist to determine appropriate instructional strategies for curriculum implementation shall not be considered to be an evaluation for eligibility for special education and related services." End quote. So, we need to keep the following in mind when reviewing school screenings, assessments, and evaluations. First, it's important to know what tests were used to conduct the evaluation. You and the team need to know why each test was selected. In other words, what was it designed to measure? It's also important to know who administered each test, their title, and qualifications they held to do so. You and the rest of the team will also want to know which subtests of each instrument were used and why. As well, you'll want to know which subtests of each instrument were not used and why. And as well, you and the team will want to be certain that all areas of the suspected disability were in fact assessed. So, how might you know if the evaluations were properly carried out? To get those answers and more, visit our website or email me directly.